My guest on this episode fights every day for sexual and reproductive health, rights, and justice. She's also a podcaster. How awesome is that? Tune in for the full conversation. You're listening to the PHEC podcast, episode 395. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. I can't wait to introduce you to my guest. But before I jump in, let me introduce myself to you. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports nonprofit organizations and government agencies that are serving Black, Indigenous, people of color communities, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always humbled and honored to serve. We help our clients collect, analyze, manage, and communicate their data and health information in plain language to the communities they serve. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us. Our website is DrCHHuntley.com. We'd be happy to meet with you and explore how we might be able to help support your organization. The links are also provided in the show notes. I am very excited to introduce you to my guest on this episode. We met at a conference a few months back, and I was drawn to her work right away because it boldly represents reproductive rights and caught my attention. I immediately invited her to be a guest on this podcast, and she accepted my invitation just as quickly. She is also a podcaster, so we had that very special connection right away. Let me formally introduce her to you, and I'll connect our conversation. Jennie Wetter is the director of the Repros Fight Back Initiative, where she fights every day for sexual and reproductive health, rights, and justice. Jennie is also the creator and host of the Repros Fight Back podcast, which is a deep dive into sexual and reproductive health, rights, and justice issues like abortion, birth control, sex education, women's rights, LGBTQ plus rights, and more. Originally from Wisconsin, she has lived in Washington, D.C. for the last 18 years. She received her BA from the University of Wisconsin-Madison and her MA from the American University School for International Service. Let's connect my conversation with Jennie right now. Oh, hi, Jennie. Welcome to the podcast. How are you?
I'm great. How are you?
I am doing really well. I'm excited for our conversation. And I feel like I say that when I start to interview every guest, but I genuinely feel that way. As a podcaster,
right?
I know
Isn't
you get it.
The best?
It is. Oh, you and I met at the APHA conference in Minneapolis a couple of months ago, and we both had a booth in the exhibit hall. And I remember when I was planning the exhibit, I looked at the little map and I saw your booth. I thought, oh, 2 podcasters back to back. How cool is this? And I had this intention of, I had this vision that we would sit down and chat. And literally the last day and the last hours were packing up. I was like, let me run over here so I can introduce myself.
I know. Forever at conferences, it's like so busy, all the people stopping by to chat, and like,
that's right.
All of a sudden you're like, it's over.
Yeah. So I'm glad that I did get a chance to introduce myself to you, and we exchanged information, and I knew I wanted to bring you on the podcast. So thank you for being here. Why don't you take a minute and just introduce yourself to everyone?
Sure. Hi, y'all. I am Jennie Wetter, she, her. I am the director of the Repros Fight Back Initiative at the Population Institute, and I also host our podcast, Repros Fight Back.
Love every bit of that. I actually have a bag that
Oh,
you're giving away
great!
from the event. Yes, I have it. I love good swag. I think, oh, this is a nice bag. It's nice and bright, and I love the message. So it says, well, actually, I don't want to mess it up. Abortion is
A human right, not a dirty
not a
word.
bad. There we go. Abortion is a human right, not a dirty word. Okay, I like it. I like it very much. So, Jennie, this is going to be a fun conversation. All the questions and all the things I wanted to chat with you about in Minneapolis that we didn't get to talk about, we're going to talk about it now.
Awesome.
And everyone will get a chance to tune into our conversation and get to know you at the same time. I think that a lot of members in my audience, I know I have a lot of colleagues who specialize in sexual health, reproductive rights. I mean, it's all important to us, but there's some people that this is their niche. This is their specialty area. So I'm excited to bring you here and to be someone that, you can connect to. So I'll make sure that we have all of your connection information so that people can reach out to you. But let's dive in a bit. And I like to ask a lot of questions that take us back a little bit. You gave us a great introduction of what you do now, but I want to roll back a bit and just chat about how you got here. So my first question for you is, when did you first learn about or become interested in public health? And I'm going to say that with a little extra on here because I know that your degree says a lot of different things and you may put yourself in different categories, but you are absolutely doing the work of public health. So yes, I'm just curious to know, when did you first learn about that?
Yeah. So I also love getting people's stories. It is like one of my favorite things. We have an annual episode we do every year where we have people come on and tell their SRHR, sexual and reproductive health and rights, origin stories. So this is totally my jam. So you're right. I did not see myself in public health for a really long time because that wasn't my background. That wasn't how I came into this. So it wasn't necessarily something I identified for a while until I started getting more involved with APHA and understanding obviously sexual and reproductive health is a public health issue. And I always say your path is different. Everyone has a different path and how they get here. So mine starts way back. I talk about how I went to Catholic school, K through 8. I literally had sex ed from a nun. As you can imagine, it was not comprehensive or effective or any medically accurate or any of the ways you could imagine. And I also remember being pretty young and having a conversation with my mom, again, Catholic school. A friend invited me to go with her to save babies at Planned Parenthood. And yeah, I want to go save babies. Obviously, that is terrible. Babies are being killed. I need to go. And I remember going home and talking to my mom and being like, Mom, can I go with so-and-so to go save babies? And I remember her sitting me down at our kitchen counter and having a really kind of frank conversation with me. I was in maybe 5th grade. I was fairly young still. And she didn't tell me what to think or what to do. She very much just basically told me to put myself in that person's shoes and was very much like, have you thought about what if this scenario happened? Or what about this? Or have you thought about that? And then at the end was very simple about if you want to go, you can still go. And obviously, one, props to Mom. If she had told me what to think, it could have been very different. But she taught me to question it and come to my own decisions, which is amazing. But sexual and reproductive health wasn't on my path at that time. I ended up going to undergrad for environmental studies. I did a study abroad in Kenya for a summer, looking at kind of where environment and development meet. So that switched my path into global. And so I went to the School for International Service at American University, studying global environmental policy. Again, not at all public health or repro. And I ended up writing my thesis in environmental peace building. So again, not at all on my path. And I started looking for jobs and was not a great economy at that point. And so was kind of struggling to find what I thought I wanted. And I see this job at the Population Institute and I was like, well, this isn't exactly what I wanted. I don't know that this is the right fit. I guess I'll try it. And then over the course of like starting to work, like starting to look at some of the more sexual and reproductive health side, the maternal health side, gender equality. Oh, wait, this is my passion. Like harkening back to like the terrible sex ed I got, thinking back to those early conversations with my mom, it really built this core of passion to make sure that people are receiving accurate information and have the ability to access services. And even then, like, so I saw myself working in advocacy for sexual and reproductive health, but still didn't necessarily see myself as a public health person. And that took a few more years, but now I couldn't imagine not working in this field. This has like become my true passion. And I love getting a chance to talk to people about it because it is one of those things that's so personal, and being able to control if, when, and how to have children and your sexual health is so innately personal that it is such a key part of who people are.
Yeah. Thank you for sharing that.
I know that was a long, winding path to get there, but
I love those details in the story. I think that when you talked about the Catholic school days, if people had that experience in Catholic school. I mean, I went to a Christian school, I didn't go to a Catholic school, but I had family members that went to Catholic school, and very familiar with similar stories of, what they understood or didn't understand and how they were educated. I am also curious about the work that you do at the Population Institute and how you end up with, like, from there to starting this podcast.
Yeah. So I do advocacy. That's my main part of my job. And so a lot of my day-to-day work is actually more on the global side. So working to ensure that we are funding international family planning programs, which help people be able to access birth control and sexual and reproductive health care in countries around the world. So that's where I spend a lot of my time. I also do our annual 50 state report card. So coming back to domestic, we put together a report card that looks at various indicators of like how your state is doing when it comes to sexual and reproductive health. I think that's one of those things that people had a good idea of what was happening nationally, right? Or you may have heard about a particular state that was doing really bad, but you may not know what all of the laws are in your state. Does your state mandate sex education? Do they require a hospital give a sexual assault victim emergency contraception or tell them about it? Does your state have expanded family planning access to their Medicaid program for if you make, how much of the federal poverty line are you at where you can get free birth control? So we wanted to make sure that people could have a place where they could look and see what the laws were in their state and also how their state compared to other states. Spoiler alert, lots of states are doing real bad. And then I always kind of talk about how I kind of stumbled into the podcast, and honestly, not stumbled, got pushed. I'm inherently an introvert. So like the thought of putting myself out there a little bit like that was scary. It came up at a board meeting as like one of those throwaway things some board member says about like, why don't y'all start a podcast? And like my boss comes into my office and is like, so we should probably talk about that. I think we should do it. And I think you should host it. And I think you would be great. And I was like, this sounds like so much work. And I don't know that I'm sold that this is a great idea. And he really pushed hard. And he saw that I could do it way before I ever considered that it was something that I would be comfortable doing or would want to do. And now it's like my favorite part of my job. Spoiler. But he also gave me the time and space to craft it however I wanted. He really did not get real involved in that. He's like, think about what it should be. How do you want to do it? How are you going to center it? And when I made it very clear that even though I work for the Population Institute, this was only going to be a sexual reproductive health rights and justice podcast. We were only going to talk about things related to that and anything related to that, even if it isn't things we work on. And he let me do that. So I get to talk about things that we don't even necessarily work on, but because they are important to sexual reproductive health, right, and justice, they need to be voiced. We started the podcast during the first year of the first Trump administration. because there were so many things happening all at once. And it was so hard to keep up with the various attacks on sexual reproductive health rights that I wanted to make sure that people were aware of what was happening, but not just feel this like paralyzed sense of everything's terrible and here are what these terrible policies are and how they're going to impact people. I wanted to end each episode with, and this is what you can do to fight back. This is how you can get involved. Now that you know this information, here are some specific actions you can take or orgs you can support if you want to make sure that you are getting involved in this fight. And that's been our podcast since then, has really stayed true to that vision. Even with change in leadership at our organization has really allowed me to continue with this vision. And then we built the Repros Fight Back Initiative around the podcast. So my work is now all within the Repros Fight Back Initiative, focused on sexual reproductive health rights and justice.
There's so much good stuff you said in there. Repros Fight Back is an initiative. So what's the title of the podcast?
Repros Fight Back.
Okay.
Like I said, it was built around, the initiative was built around it. Yep.
Gotcha. So I love that you were given that flexibility when you're taking on a creative project like this one, and there's so many moving parts. The strategy piece is so important. And I love that you had the type of leadership that said, we want to do this. We believe in you. And then give you some freedom to decide what that needed to look like and then support you. That is so important. I love that so much. I also love how you have, like you said, there's always these issues and problems. There's so much to talk about. We could be angry about it all the time, but you close each episode intentionally with, okay, when this is what you can do, like an action item, some steps. And that's important also because when we're talking about topics like this one, where there's a lot of change and emotions involved and shifts between states and between countries that are so different, it's important to give people something like some tangible steps, like some action items that they can decide to take action on and to do something about it. And other than just sit there and be angry and wallow in it.
It's so easy to get paralyzed, right?
Yes,
like you just get overwhelmed. And we tried to make this actions like, yes, you can donate, but honestly, sometimes the big thing that needs to happen is having conversations with people to bring them in. Mm-hmm. And, only as much as you are comfortable. Don't get into like hostile conversations if that is not something where you feel comfortable. But just bringing people further in and getting them to understand what's at stake is really important.
Yeah, I agree. I think that, and you're seeing this, but as you're talking, I started my podcast and then my business grew from that. And over the years, I've actually really helped other organizations start podcasts. And there's such power in that, especially with an organization that is like those nonprofit organizations that are health focused and really with passionate leadership. And it's a way to connect with community. It's a way to fill in gaps and reach people, oftentimes in ways that you wouldn't otherwise. It becomes a source for you think about your audience members, they can connect with, yes, more about what your organization does, what, is happening at Population Institute, but they're also becoming informed. You become the resource. And then that is such a strong authority added to the brand. I think that when organizations do this, and one in particular that we produce a podcast for is the Tribal Epidemiology Centers. And that is everyone in the organization now that first they were sponsored episodes on our podcast, but then they have their own podcast now that we produce for them. And it's a very exciting direction to go in, and also a way that you can connect with community that I don't think anything else can touch it.
Yeah, it's so personal. And like my podcast, like yours, like we have guests come on from other orgs. So like they're not just connecting to me. I'm getting to connect them with other orgs they might not be familiar with, issues they may not be familiar with. And so that is like some of my favorite part of one, I work with so many amazing people in Coalition, and I get to let them shine their light. Yeah. So other people can see it. And that makes me so happy to get to show off all of these amazing people and friends that I'm lucky enough to work with every day. Like that makes me so happy.
Yeah, I definitely get it. I wanted to know, I told you that we were going to I knew the conversation was going to be great. So I'm looking at my notes so that I can make sure I try to stay on point a little bit. But this is all I think my audience is appreciating it also. I say it a lot, your organization should think about a podcast. So I took the opportunity it's like, see, you guys listening. This is an example of what I've been talking about. So when you think about the population, the issues, is there one particular population or a specific issue that you are most passionate about kind of under this umbrella?
I get to work on so many things. So I will always have a huge passion, even though I do not get to work on it every day, of sex education. Because again, back to that story I told at the beginning of, I know the harms of getting such terrible sex education, and I want to make sure nobody has that again. So that is something that, while I don't get to work on it a lot, I do try to bring it up on my podcast as often as I can because it is really important to talk about. Like I said, I spend a lot of my time focusing on global sexual reproductive health and rights and also gender issues. So we also do a lot of talk and work around gender-based violence globally. This is, again, a very personal issue. As somebody who has experienced intimate partner violence, it's something that I deeply feel strongly passionate about and want to make sure that we are drawing attention not just to it exists, but the spectrum it exists on. I think that is such an important thing because often it is, especially when I was growing up, right? Like the way you understood intimate partner violence was only really physical and not understanding that it is so much more than that, emotional, financial. There are so many ways that you can experience it. And it's really important that people talk about it so that you know it when you see it. I didn't know. I had no idea until I started doing this work. And then I looked back and was like, oh, I'm a survivor. Oh,
Yeah.
I never saw that in myself before until I started doing this work and understood the issues better. And then we do a lot of work on abortion. And to me, that's when you get into access, right? And access is such a simple word that hides so much complexity of, is there a clinic near you? That's one way to look at access. But also, do you have the ability to afford it? Can you take time off of work to get to an appointment? Do you have childcare if you need childcare? Like there are all these factors. And so you need to look at the communities who are most impacted by these bans. And so that means you are talking about Black people, you're talking about other Indigenous people, people of color, you were talking about people who are low income, you're talking about the LGBTQ community and those with disabilities, and those who sit at multiple intersections of those identities. And those are the people who are really struggling to get access. And until we ensure that they have access, and when we can meet those needs, then we know that we have really achieved something.
Yeah. So I'm going to ask you, we could go way down the rabbit trail, but I do want to know, is this something that Population Institute addresses in terms of what you're talking about, access, abortion access?
So we don't do direct access. And so one of the things I always make sure to do on the podcast is talking about the importance of funding abortion funds and the groups that are doing that work on the ground, because that is super important and making sure that people have access. We're an education and advocacy-based organization. So we do a lot of raising of the issues. We bring them to Congress to work on increasing funding, those type of things. So that is not within our scope of work, but we work with a lot of groups who are doing that. And I try to then make sure I am highlighting them on the podcast so that people are hearing about the amazing work that they are doing to ensure that those communities' needs are being met, because again, they are so important. And so we make sure to lift that up and talk about it, but it's not our core focus. The core focus is making sure that people have access to sexual and reproductive health, no matter who they are or where they live. And so often some of that gets lost in talking about the big picture, but always raising that until there are groups who have special needs that have to be met.
Yeah, yeah.
And that looks a little different, right? So again, we talk about global. So then that may mean they're rural. It may mean they are Indigenous. It may mean they're a cultural minority. So there are little nuances that look different when you're talking about our global conversation versus our domestic conversation.
You're right, right.
Although rural still has problems with access here in the US, right?
Right, yeah. I'm in a state that's, the whole state is rural.
Yeah.
So I definitely get it. I'm going to go back to the report card that you mentioned.
Yeah.
Is that available through the website? Is that
Yes.
publicly available?
Yep. So if you go to reprosfightback.org/report card, you will get it. It's an annual report card. It comes out generally like February, March, depending on how fast I can get it out. So you can see last year's report card is available already. So right now we have 25 states who are getting failing grades and only 5 who are getting A's.
Oh my goodness.
It's basically exactly what you would expect when you look at a map. I don't think anybody will see anything that is super shocking to them with so many states that have banned abortion, but they also are failing in so many other areas. I think that's one thing that we really tried to make clear in the report card. It's not just that states are failing on abortion. They are failing on abortion, but they are also failing. Sex ed is one that I see so many states either don't mandate it or they mandate it, but they don't require it teach information about condoms or birth control or, it's not medically accurate. So there's a whole list of things that we have as sub-indicators under that. We also look at making sure it's affordable. So did your state expand their Medicaid program under the Affordable Care Act? There are still, I think, 9 states who have not expanded, or at least as of last year's report card. So there are still a lot of people who should be able to get coverage, but aren't able to get coverage. And for a really high percentage of births are covered by Medicaid. Plus, you get access to birth control and family planning services via Medicaid. So it is very much a reproductive health program.
Yeah. Do you happen to know which of those 5 states got A's?
So it's Oregon, California, New Mexico, New Jersey, and Vermont.
Oh, okay. All right. Well, congratulations on the A's at least for 2024.
Yeah. There are some states that I always find surprising. And I think mostly with sex ed, the states that don't mandate good sex ed or any at all, some years I'm consistently surprised. Massachusetts does not mandate sex education.
Yeah.
New York doesn't mandate it to cover birth control or condoms. So, they don't get any points. That is shocking to me every year that they don't have good sex ed.
Well, I'm going to make sure, because I'm thinking about now the time that we're recording this, we're at the end of 2024. But by the time this episode is released, it's actually going to come out around the time frame that the new report card will be released or soon after. So definitely you're hearing us talk about it at this kind of point in time, but make sure that you check their website for the newest report card. I think that's going to be really interesting to see.
We're working on a fun new microsite for it so that you can go and play with the indicators. So you can go and click on sex ed and see how states are scoring on sex ed only. So you can do it by the different measures we have. So I think it'll be fun to get in there and play with it and be able to see how this variation breaks down by some of these categories we look at.
Yeah. I'm looking forward to that myself. Oh, wow. This has been so much fun. We have a variety of listeners. And like I said, some people that are very kind of niche and focused in this area of sexual health and reproductive rights. Do you have any bit of advice that you could share with someone who is, I almost think of this work as kind of fighting uphill with the majority, I think especially in the U.S., the majority of, the states are failing and it's, we're going backwards and it feels like it in a lot of ways. What advice could you give or share with anyone who's really wanting and continuing to stay in this niche and to do the good work, but maybe feels exhausted?
So I have 2 bits of advice I think about. And one is one I always give to our interns when they come. Well, actually, I tell them both, but this one is particularly for young people starting off. There is no path, right? There is no, this is the right choice or that is the right choice I have to make. Otherwise, my career is going to fall apart. As I talked about, I came from environment. So there is just your choice and you are building skills that you can take into your next career step and nothing is closing doors to you. So don't stress so much about that first job or that second job, right? Skills are transferable. You can learn about new issues if you start in a different field within public health. yes, this last job was sexual and reproductive health, but okay, this next one is maternal health or something else. Like, you learned how to do the advocacy, you learned how to do whatever. So, like, skills are transferable. Don't think you are locking yourself into anything and really stressing about that first step or that next step. I think that's something that I've encountered so often with young people, is they're so worried about making the perfect career move. And I think you got to let that go a little bit and know that nothing is like you're that first job. It doesn't mean all of a sudden you can only work in that field. There's lots of flexibility in there. And then I think the next thing that is really important is that this work is so personal and so emotionally draining in this environment, and that you need to prioritize yourself and your self-care. It's so easy to burn out in this. If I let myself get caught up in it every day, like, it's so emotionally draining and taxing. And that this is going to be a very, very, very long marathon. I do believe we're going to win. And so that keeps me going. But like, it is going to be a very long fight. And so that means you can't do all the things. You have to step back when you need to step back. You have to know, like, I can't do this thing. This is not in my wheelhouse or comfort zone. I know I get anxiety in crowds. So if there's like a big protest or rally, like, I'm not going to go, because that is my self-care of not going and stressing. So I find other ways to engage. So really finding ways where you can engage and stepping back where you can and taking care of yourself, whether that's I'm trying to stay off social media more. I do baking. I watch the Great British Baking Show when I'm like really stressed. So like finding the things that are nurturing for you and taking care of your community and letting your community take care of you. I'm not always good about that second one, but like it is also really important, and you don't need to do all the things. And I think that is my second really piece of advice of like self-care is so important, and trying to not do everything, because you will burn out. And that's when people leave the field. There are so many people I know who have burned out, whether it's because of the work, because of job situations, and then have left this field completely. And we need good people in this fight, because it is going to be a long fight. So taking care of yourself and your community is really important.
Yeah, thank you for that. I absolutely agree with you. And it was actually the message in a keynote that I delivered when we were in Minneapolis, that importance. And I chuckle because, like you, some of the things I share, I'm not always super good about doing, but I know I need to.
Try.
So yeah, so great feedback, great advice. Thank you for that.
And for like people who are like further on in their career and have people under them, like some of that is leading by example. So one of the things is I really push for the people under me the importance of taking mental health days. But if I'm not taking them and showing them that I am taking them, no matter what I say and how much I tell them that it is good that they do it, they may not do it. So some of that is like, you have to lead by example. So that is my commitment to myself and to my team for next year of like, I am going to be better about taking those mental health days so that they know that they're also highly encouraged to do so. Because again, we need everybody in this fight, and we can't have people burning out.
I 100% agree with you. Wonderful. Thank you so much.
Oh, thanks for having me.
Yes, I've enjoyed the conversation, getting to know you and more about the work and your organization. And I mean, I took a whole page of notes, and this is something that I know my audience is appreciating. So I'm thanking you for them. I look forward to keeping in touch with you, because I just feel like
absolutely,
we have more to talk about.
For sure.
Well, Jennie, I will be in touch with you again real soon. Thank you again.
Thank you.
I really hope you enjoyed that conversation as much as we did. I especially like the tips that Jennie shared, especially the importance of prioritizing self-care, because this type of work is emotionally draining. This aligns so well with my message in the episode right before this, episode 394. If you have not listened to that one, I do recommend that you make some time to do that soon. Jennie is a great leader, communicator, and advocate, and is having a big positive impact on all of the communities that she serves. I encourage you to connect with her, learn more about the work that she's doing, and check out her podcast as well. You can find the links to connect with her in the show notes for this episode. The show notes page for this episode, which is episode 395, can be found at phecpodcast.com. Once you're there, just navigate to episode 395 to find its show notes. While you're on our website, you can also click on the Consulting tab from the main menu and submit a request to meet with us and explore how our consulting services could support your organization as well. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.